My goal for my patients are that through our interaction and through our relationship that they feel empowered, that they can take back some of their health and the power over their health. My name is Lindsay Adrian. I'm a naturopathic physician, and so I have a degree in chemistry and then of course my naturopathic doctorate, my ND. When I was in school, I knew that I wanted to focus my practice on cancer and chronic disease. And so still as a student, I joined the Oncology Association of Naturopathic Physicians, got really involved in all of their continuing education things, and just really focused my learning in those last couple of years specifically on cancer and on what would be called complex chronic disease. And then as soon as I finished my residency, I actually started at an integrative cancer center focusing on really honing my integrative cancer skills and directly working on my fellowship. And through that and through the connection between immune and inflammation and just supporting all of those processes and how interconnected the process of cancer development and the process of autoimmune development and the pathology of a chronic infection, there was sort of a very natural weave and ebb and flow to creating a practice that encompassed all three of those. So I really focused my practice on cancer and chronic disease, predominantly because there was such a gap between how people were experiencing these conditions and how they could be experiencing these conditions. And I really wanted to ensure that if at all possible, I could close that gap and have people experience cancer in a different way and experience autoimmune disease in a different way and thrive through these conditions rather than being really beaten down by these conditions. In having practiced for the last 9 years, what I found was in the beginning, I really focused on honing in and really trying to get down into the narrow sort of biochemical pathways of what's happening in a cancer cell and what's happening in an autoimmune disease. And then through my patients' experiences and through my experiences as a physician, I've broadened that right back out again and recognized that it's not just about the minutia, because our body is so efficient and we have so many redundancy pathways. So it's not so much useful to get narrower and narrower and narrower. Oftentimes it's about asking big picture questions, right? What, in the larger scheme of things, what are the driving factors in this disease? What are the main sort of therapeutic targets? And again, having that be a broad target, not a narrow target. Because our body is not narrow, our body is not, one single path. I would say most typically when I'm having my very first consult with a patient who's been either recently diagnosed with cancer or who's been living with the disease for a little while, oftentimes they're coming to me because they're scared and they don't know what their options are, or they feel frustrated with what their options have been and they're looking for something more. And so I think regardless of the type of cancer, I think regardless of the age or the stage or where people are in their journey, it's about helping people to feel heard. It's about helping people to recognize that they do have options. Even within, can you choose to eat a different way? Can you choose to take on a different lifestyle? Are there things to ask or things to consider in the conventional world as well? And just helping people to guide them through that asking questions and through taking back some control over their lives. After I see a person for the first time, typically my approach is to work with that person to create a plan that fits both where that person's at and the condition and the symptoms that they're experiencing. So something that's very important to me is matching the treatment with the patient and meeting the patient where they're at. And so, for example, dietary change. Some people come in and they are ready to make a complete overhaul. Other people come in and they are so completely exhausted and so completely overwhelmed that it's little things, it's small steps. both are wins, both are the right course for each of those patients. And it's my goal and it's my job to help support those patients following their goals and with steps that are manageable for each of them. So, when speaking about cancer, when speaking about all the various types of cancer, one of the things that I like to do is group them into families, because then we can understand common mechanisms, we can understand common treatment goals and treatment targets. And so, for example, breast cancer, prostate cancer, these are both very hormone-driven cancers. And so managing hormones is one of the treatment mechanisms. So again, I think it's very helpful, no matter what kind of cancer a person has, is to try to categorize what are some of the treatment goals and what are some of the really more aggressive hallmarks of that cancer so that we can target them. Within cancer, my long-term goal is really being able to change not just the experience of the person who sits across from me, but the experience of anyone who's diagnosed with this disease. And so that means that I need to engage in research. I need to engage in speaking. I need to engage in both public and professional education so that these fantastic integrative methods that we're using become standard of care. And I mean, that ultimately, if I can look back 20 years from now and see that standard of care has changed, that would be my all-time greatest achievement.